Hello, and welcome to Willow Waves, a student-produced podcast that brings together young minds to explore and discuss current events and topics that connect all of us.
Hi everyone, and welcome to the Willow Waves, the official podcast of Willow Springs Elementary. I'm Santi.
And I'm Adam. And today we have a fascinating episode for you. We're talking with Dr. Kirsten Gilardi, the Executive Director of Gorilla Doctors and the Director of Wildlife Health Center at UC Davis.
Dr. Gilardi works with teams to protect endangered gorillas and other wildlife around the world. She'll tell us how animals, people, and the environment are all connected and how science helps keep them healthy.
Let's jump into our conversation with Dr. Gilardi and learn how Gorilla Doctors is making a difference, one gorilla at a time.
Okay, so we have about 10 questions for you. We're going to start with some personal ones. What inspired you to work with gorillas and become part of Gorilla Doctors?
That's a great question. So 3 things. One is I am an animal lover, and I have always had a particular place in my heart for wild animals. And I've loved all my life, I've loved seeing animals in the wild. So that's where I started. I also, when I went to veterinary school here in California, and right after veterinary school, my first job was taking care of monkeys. So my area of expertise as a veterinarian is with monkey medicine. Third, again, back to the reasons how I got involved and why did I become part of Gorilla Doctors, is that about 15 years ago, a colleague of mine suggested that he and I work together to oversee and run this amazing Gorilla Doctors program, which was providing veterinary care to gorillas in the wild. So for me, it combined my love of wildlife, my expertise in monkey medicine, and I could bring those together with the Gorilla Doctors program.
Wow, that's very cool.
Yeah, that's a really good answer.
Now I'll ask you a question. What does a typical day look like for you working with gorillas?
Yeah, so I oversee the whole program, and we have a number of veterinarians in Africa who do the work to care for the gorillas. We have veterinarians in the 3 countries where mountain gorillas live, in Rwanda, Uganda, and the Democratic Republic of Congo. And a typical day for our veterinarians is that they might be called by a ranger in one of the parks where the gorillas live and that ranger may be calling to report about a gorilla that is injured or ill. And so our veterinarians take all of the equipment that they need to potentially take care of a gorilla patient. They put it all in their backpacks and they hike into the park to find the gorilla and observe the gorilla's situation with their own eyes and make a decision, as all veterinarians do. After they do an initial assessment of a patient, they decide what their treatment plan is going to be, and that's what our veterinarians do. And I think the most important thing to think about in our situation is that we don't run a gorilla hospital. Our hospital is the forest. The veterinarians do all of their work to take care of the gorillas inside the national parks where the gorillas live. We don't take the gorillas out of their forest to take care of them in the hospital and put them back. So our patients are wild, our hospital is the forest. It's a very, very unique situation. So every day is different. Some days when there are no reports of gorillas being ill or injured, our veterinarians go into the park just to simply use their eyes to check on the health of all of the individual gorillas in a particular family group. And these gorillas live in very tight-knit family groups. So every day is a little different.
Wow, that's so cool.
Anyway, we're going to talk about gorilla health and how you care for them. How do you keep these wild gorillas healthy?
There are a few things. One is, of course, we're providing care if they're ill or injured, and that almost always restores the gorilla's health. But we also care about what we call preventive health. So what are the things that we can do to make sure that gorillas don't get sick? And a very important thing to keep in mind about our work as the Gorilla Doctors. The gorillas are very, very similar to you and me. They share almost all of their DNA with us. So that means that they are susceptible to different viruses and things that they can get from people. So one of the things that we do as gorilla doctors is really promote and emphasize the importance of what we call best practices around the gorillas. And that includes that people maintain a certain distance from the gorillas when they're in the forest, so that if people were to cough, somebody who might be sick but not even know it, right? They might have something infectious in their system that they could potentially give to the gorilla. They maintain a good distance. It's far less likely that they might pass that, for example, a virus to the gorillas. And of course, we really promote that everybody be as healthy as they can be when they go into the park to be near the gorillas. And that includes the people who work in the park. So we actually, as the Gorilla Doctors program, have started and have continued to support what we call preventive health for the park workers. So every park worker gets seen by a doctor every year to just check on their wellness. So that's an important thing. And then finally, I'm going to say that everybody who goes near the gorillas now wears a mask, just like we did during the COVID pandemic, to prevent transmission of viruses to the gorillas. And that's been very important, because that is, as you know, a very important preventive measure that can keep the gorillas healthy.
Yes, that's very important to do.
All right, now, what kinds of health of illnesses or injuries do gorillas usually have, and how do you treat them?
Yeah, good question. So when we first started many years ago, almost 40 years ago, the main reason we got started as an organization is because a very famous primatologist, a person who studies primates, monkeys, her name was Diane Fossey. She was in the forest every day with the gorillas, observing their behavior to understand what underlies their behavior as a great ape. And she was becoming increasingly concerned about the number of her study animals that were getting caught in snares. So snares are rope or wire. They're loops of rope or wire that are set in the forest illegally by hunters who are simply trying to catch small wild animals to feed their families. But sometimes the gorillas get caught in those snares just in the process of moving through the forest. You know, gorillas are vegetarian. They just eat plants, but they have to eat a lot of plants in order to maintain their nutrition. So they go through the forest and eat plants almost all day. When they're not taking a nap, they're eating, and sometimes they get caught in the snares. So we started out as the veterinarians for gorillas, the mountain gorillas, to remove those snares safely and make sure that if they were injured by the snare, that we could treat their injuries and give them antibiotics and give them pain relievers and allow them to recover from that injury. So that's still something that's important. That's important work that we do. Unfortunately, snares are still set in the forests, and so our veterinarians will go in to remove them. But we also will treat gorillas. For example, I talked about how gorillas and people share our DNA. So gorillas are susceptible to human viruses. Sometimes we need to go and treat a gorilla that has a bad cold or maybe even pneumonia that it may have gotten from a human virus. And so we'll go in to treat gorillas for their respiratory disease as well. And lots of other things. You know, gorillas are not that different from people. They're generally incredibly healthy, but sometimes they get sick or injured for a variety of reasons. And we're always checking every ill or injured gorilla to decide if our treatment is necessary to save their life. Now, sorry, I'm talking a lot, but you're asking good questions. One thing to keep in mind is that, you know, we don't treat every ill or injured gorilla, because disease, illness, injury is a part of their normal life, just like it is for us. So we don't want to play Mother Nature and interfere every single time a gorilla is ill or injured to save its life, because some of that is just part of their natural life, and we don't want to mess with that. But when we think that maybe an injury or an illness is related to the fact that people come close to the gorillas every day, then we feel the obligation to treat them.
That's a good answer. That kind of leads to our next question. How do you approach a gorilla without scaring it away?
Yeah, great question. So mountain gorillas in the world are very unique in that most of the world's mountain gorillas are what is called human habituated. That means that the people who work in the parks have taken many months to allow the gorillas to get very comfortable and accustomed to the close presence of people, so that the gorillas don't feel that people are threatening or scary, or that they don't need to run away from people because people are not a threat. And the reason for that is that the tourism that is possible in these parks, it brings in an amount of money that's extremely important for managing and protecting the parks where the gorillas live. So by habituating the gorillas to the close presence of people, people can study them, people can see them as tourists and go in, pay the park in order to go in and spend a whole hour in the close proximity of a mountain gorilla family group. It allows us as the veterinarians to do our work. So it's a very unique situation where the gorillas have been purposefully made to feel comfortable to have people around. And that is for conservation purposes first and foremost, but it also facilitates research.
That's amazing. Thank you for that answer. Moving on to conversations and challenges. Why are mountain gorillas and eastern lowland gorillas endangered, and what can people do to protect them?
Great question. So unfortunately, as with a lot of wildlife in the world, as there are more and more people sharing the planet with them, there is less and less place and habitat and space for them. So one of the things that has caused gorillas to be endangered, and let me say here that, remember, if you picture the continent of Africa, the whole middle of it is all tropical forest, and that's where gorillas live. And on the western side of the continent is where western lowland gorillas live. And if you've ever seen a gorilla in a zoo, it's that species of gorilla, the western lowland gorillas. Then on the eastern side are two subspecies of the eastern gorilla. One is the mountain gorilla, and the other is the Grauer's gorilla. Mountain gorillas are endangered, Grauer's gorillas are critically endangered, and it really is about having to share their habitat with people, and that habitat that they need to sustain life becoming, shrinking, because there are more and more people using that habitat as well. So that's a big factor. And then again, back to what I mentioned earlier about the fact that gorillas and people are so closely related genetically, it means that gorillas are uniquely susceptible to disease.
We have another question for you. What is the hardest part and most rewarding part of your job?
Oh boy. Let's see. Hardest part. Let me start with the positive. The rewarding part is, of course, the animals. The gorillas are absolutely amazing animals, and if you ever get the chance to see them, you will know what I'm talking about. It's very hard to describe, but they are big. They're beautiful. The way they live in the forest and their families, the fact that they live their lives in a way that's so similar to ours is just it's just magnificent. And so the best part of my job is being able to see the gorillas. I'd say the hardest part is just thinking about all the things that could threaten their survival. What are the things that might mean that we don't have a thriving population of mountain gorillas in the future, and how can gorilla doctors prevent that? What are the things that we can do as an organization to make sure that mountain gorillas survive in the wild? And so, we work in 3 different countries. They are very different countries. They each have their own challenges. And so I would say that that the hardest part is just is the work, making sure that we can save gorilla lives. And we do it well, but that doesn't mean it's not hard.
Okay, I have another short question for you. What 3 countries are you guys located in?
Our veterinarians work in Rwanda, Uganda, and the Democratic Republic of Congo. And that's in the east central part of Africa.
Very cool. All right. Now we're going to do, have you ever really had a really difficult case where you weren't sure if a gorilla would survive, and what happened?
Oh, so I would say that fortunately, almost all of our gorilla patients survive. And we are able to see that they're ill or injured early enough to provide the treatment that will help them get through their injury or illness and survive. So first, most of our gorilla patients survive, but sometimes they don't. I will say that one of the most dramatic, and this was not, they were not our patients before they passed away, because they, of all things, they were struck by lightning. So sometimes gorillas suffer from things that have nothing to do with people, but can be very, very devastating. And a whole group of gorillas was way up in the mountains in a very, very severe storm. And of all things, they were struck by lightning. So that was not a situation where we could do anything about them. We do have cases where gorillas are really, really good at hiding their symptoms. So sometimes we have a gorilla patient that one day is fine, seems fine, and the next day they're very, very sick. They don't want to get out of their night nest in the morning. A night nest is their equivalent of bed, just like you and me. If we don't feel good, we just want to stay in bed. Well, sometimes gorillas wake up in the morning in their night nest, which is just a little area of vegetation, and they don't want to leave the nest with the rest of their family who are off foraging, feeding on plants. And sometimes that's overnight, that situation presents itself. And in some of those situations, the gorillas are so sick that there's very little we can do for them because their disease has gotten very advanced. They were able to hide their symptoms. We didn't know it until, for example, they might have a very bad chest infection and they didn't cough, they didn't have runny noses, they didn't have labored breathing or anything until we noticed that they were really feeling badly. So those are very tough cases. We can't always save all of those gorillas.
Wow, that's very interesting.
All right, now we're going to talk about One Health approach and future goals. Can you explain what One Health approach is and why it's important for gorillas and people?
Yeah, so One Health is this idea or this perspective that the health of people is inextricably linked to the health of animals, the health of the environment, including the plants in that environment. The health of those things are all interdependent, and you can't address the health of one without considering the health of others in that system. And it's the critical approach for our work because, as I've mentioned earlier, gorillas and humans are almost the same. So we can't take good care of the gorillas without applying that One Health approach to the fact that we need to make sure that the humans that are near them are as healthy as possible. We need to make sure they have healthy habitat to live in. It's only when we get all of those pieces of the puzzle right can we save gorillas from extinction. And when we're doing it, I mean, I think that's a really important point to make to you and your listeners, is that there are very few wildlife success stories in the world, unfortunately. There are a few cases where people, through their actions, have been able to bring wildlife who are under threat of extinction back from the brink of extinction. For example, California condors, where there were very few individual birds left in the wild, and they were brought into captivity and cared for by people and by veterinarians, and they were able to reintroduce California condors to the wild, and now they fly all over my state, and they're all the places where they were supposed to live. Mountain gorillas are the only great ape. So remember, the great apes include all the gorillas, the chimpanzees, the orangutans. Mountain gorillas are the only great ape whose numbers in the wild are increasing. And that is because of this One Health approach. It's because it's been a very highly collaborative approach to ensuring that all parts of that One Health system are improving and healthy in order to help the species survive.
Wow, that's amazing. What advice do you have for children who care for animals and also want to grow up to be an animal expert or whatever type of animal they want to?
Great question. Well, first of all, you two are doing it right now. So helping your friends and other students in your school understand about wildlife and animals and the things that help them or the things that may be a problem for them and the different solutions. Just raising that awareness and that appreciation is really, really important. I think doing whatever you can to learn about the animals that you're passionate about at this point in your lives, you have so many opportunities to learn as much as you can. And when you have that knowledge, you can then apply that knowledge to being part of the solutions to some of the things that face animals, whether we're talking about dogs and cats and horses and cows or animals in the wild. They all need humans, people like you and me, who really care about them and their survival, both as individual animals and as whole populations of animals. So learning everything that you can, applying that knowledge and sharing that knowledge with others is incredibly important. And that, because it's where it starts. You guys, you're at the, you have your lifetime ahead of you to do whatever you can to help animals if that's what you want to do, and it starts right now. And you're doing it already. Obviously, you've asked great questions with this podcast, and I'm excited that your friends and your fellow students are going to learn something about mountain gorillas, and that helps the world when people like you take the time to learn and to be passionate about animals.
Wow, that's very intriguing.
Yeah, that's great advice for people who love animals. That was our last question, so we're going to sign off now. Thank you so much for spending time with us.
Thank you, guys. Thanks, Adam. Thanks, Santi.
You're welcome.
Bye.
Bye.
A huge thank you to Dr. Gilardi for being here on Willow Waves and sharing the amazing work of Gorilla Dog.
Conservation and how science is used to help animals and the people around the world.
If you enjoyed this episode, be sure to follow Willow Waves and check out more interviews coming soon.
Thanks for listening, and remember, big ideas start here at Willow Springs. We love learning about wildlife health,